With a mix of relief and caution, older adults fully vaccinated against the coronavirus are moving out into the world and resuming activities put on hold during the pandemic. Many are making plans to see adult children and hug grandchildren they haven't visited for months, or longer. Others are getting together with friends indoors, for the first time in a long time. People are scheduling medical appointments that had been delayed and putting trips to destinations near and far on calendars. Simple things that felt unsafe pre-vaccination now feel possible. Petting a neighbor's dog, going for a walk in the park, stopping at a local hangout for a cup of coffee. "I feel I can breathe again," said Barry Dym, 78, of Lexington, Massachusetts, expressing a widely shared sense of freedom. The rapid rollout of coronavirus vaccines to people 65 and older makes this possible. As of early last week, nearly 49% of seniors in the U.S. had been fully vaccinated, while nearly 73% had received one dose of the Moderna or Pfizer-BioNTech vaccine. A third vaccine, from Johnson & Johnson, became available earlier this month and requires just one dose. Recent guidance from the U.S. Centers for Disease Control and Prevention recognizes the protection that vaccines offer. People who are fully vaccinated, the CDC said, can meet indoors without masks, without incurring significant risk. They can visit relatively safely with people who haven't been vaccinated, so long as those individuals are healthy and gatherings remain small. Still, with coronavirus variants circulating and 55,000 new infections reported daily, the CDC continues to recommend precautions elsewhere, such as wearing masks, staying physically distant in public and refraining from air travel. How are older adults who've been fully vaccinated, a privileged group, to be sure, given the millions of seniors who've yet to get shots, balancing a desire to shed isolation with a need to stay safe amid a pandemic that's not yet over? I asked several people I've spoken with previously about their plans and their reflections on the difficult year we've been through. Mardell Reed, 80, of Pasadena, said she wasn't sure she'd get inoculated originally, because of the speed with which the vaccines were developed. But Reed changed her mind, she said, once we all started hearing from actual scientists rather than politicians. Now, Reed tries to educate people she knows who remain reluctant. One of them is her 83-year-old stepsister. No one had explained anything about the vaccines to her, Reed said. I talked about all the things that would be possible, seeing her daughter, who lives up north, seeing more of her grandkids, and I think that convinced her. Among Reed's priorities in the months ahead, visiting with her daughter, grandchildren and great-grandchildren, and seeing her primary care physician, a dentist, a neurologist who's treating nerve damage and an eye doctor.